Hi, I'm Jack Cush. This is the RheumNow Week in Review. It's Friday, the 22nd of July, 2016. A number of news items this week on the website of interest to rheumatologists and furthering our knowledge. A new review of the randomized controlled trial data from tofacitinib looked at women of childbearing potential and found 1,821 patients, and amongst those women of childbearing age, they actually had 47 pregnancies in their RA and psoriatic databases. 33 of those patients were on monotherapy, and the follow-up of those patients, in all but one, they had complete data. They showed that there was about a 14% spontaneous abortion rate. That's been reported before in RA patients on biologics. They had one congenital malformation, about the 2% risk, and that was a pulmonic valve stenosis. And there was no deaths amongst their offspring. So early data, but encouraging data nonetheless on this Category C pregnancy risk drug. BMS has announced the release of its new auto-injector. Its name is called ClickJet, and can now be used for patients who require an auto-injector to give 125 milligrams once a week of abatacept. A review of colorectal cancer patients, not a large cohort, but nonetheless an interesting cohort that did show that somewhere between 10 and 50% of patients with proven colorectal cancer were ANA positive, depending on the methodology used to detect the ANA, whether it was an EIA or an immunofluorescence assay, suggesting again there are multiple causes for ANAs. Pirfenidone actually has been studied in patients with scleroderma. Pirfenidone, a drug that's been around since I was in medical school, a long time getting to the FDA, an antifibrotic agent, has been approved by the FDA for idiopathic pulmonary fibrosis. And in an open label study of 63 patients with scleroderma and pulmonary fibrosis, they found the drug to be quite tolerable at multiple doses. However, not the intent of the study, but they did look at efficacy, and they really found no clinical benefit to using pirfenidone. We await further trials in this drug that could be of potential use in a disease that needs more therapy. If you're looking for a good review on ankylosing spondylitis and spondyloarthritis, the current edition of New England Journal of Medicine has a great review written by Drs. Torog and Colbert, and should be part of your reading material. The Wedgen study, this is a French study that looked at patients who had 112 patients who had either GPA or MPA, and were treated with rituximab, and then their long-term follow-up looked at Imuran and methotrexate and compared the efficacy and safety of those drugs in a long-term follow-up. So with a 10-year survival of those drugs in those patients, they found that they had a similar performance with regard to the efficacy, time on drug, relapse rates, and overall toxicities, suggesting that either of them would be useful additions in patients with MPA and GPA. If you're looking at the treat the target issue and you're not a believer, or you are a believer, you're looking for evidence. And there is a new study out that looked at 198 early RA patients who examined the benefits of treat the target. They showed that at 12 months there was no benefit to X-ray outcomes, but actually as time went on, at 3 years, there were significant outcomes on X-rays. But unfortunately, there was no significant improvement in DAS or function at the 3-year time point in those who were treated with a treat-to-target strategy and adhered to it. So again, we need more information about the long-term utility of truly being treat-to-target. And then lastly, from the social feed, methotrexate in psoriatic arthritis is often touted as a useful drug. A bunch of researchers examined how often patients on methotrexate achieve a new important outcome in psoriatic arthritis trials and practice called MDA, or minimal disease activity. And they found that this was achieved by 20% of patients on methotrexate. Minimal disease activity requires at least 5 out of the following 7, sort of like an ACR 20 response, and that would include a PASI response, an enthesitis measure, body surface area, skin involvement, a HAC less than 0.5, patient global less than 20 out of 100, patient pain less than 15 out of 100. So again, you'll probably be seeing more about MDA in psoriasis trials in the future. Some of our lead news stories, we actually had one yesterday about epigenetic changes in autoinflammatory syndromes. And this comes from the Journal of Allergy and Clinical Immunology, where they looked at, a group of investigators looked at the DNA methylation or epigenetic changes in genes in patients with CAPS, or the cryopyrin-associated periodic syndromes. They also looked at FMF patients, but in general they found that DNA methylation was important when monocytes would become activated or during their differentiation. And when they looked at normal controls, that was in many ways the way the inflammasome would be activated, was through through a certain amount of DNA methylation. When they looked at patients with CAPS, however, they found actually a more efficient or a greater degree of DNA methylation that would indicate the upregulation of the inflammasome. And then more importantly, when they were treated with an IL-1 inhibitor, DNA methylation would actually be decreased. An important finding about epigenetics and its regulation of disease activity in a puzzling group of disorders called the autoinflammatory syndromes. Another study was reported in Reuters about over 6,600 Canadian women on bisphosphonates and the utility of their monitoring. And they actually showed that 1 in 5 or 20% of patients on bisphosphonates actually had a lowering of their DEXA scores over time. And the net takeaway from that report was that continued monitoring of bone density is a necessary and cost-effective tool in patients with osteoporosis and those at risk for fracture. Recent FDA hearings looked at whether we should approve drugs for non-radiographic axial spondyloarthritis. There was a lot of trouble with understanding spondyloarthritis, the new criteria, the new nomenclature, and the question is whether maybe such patients don't really even have that. If they don't yet have x-ray changes, maybe they have fibromyalgia. So a group of investigators in Israel looked at about 100 patients with fibromyalgia, seeking to see whether they actually had evidence of spondyloarthritis. They found, and interestingly, 8% had x-ray evidence of sacroiliitis. They found 10% who had met the ASAS criteria for axial SPA. And then when they looked specifically at the MRIs of these individuals, they also showed that somewhere between 17 and 25% had imaging evidence of inflammation in and about the SI joint, erosions, etc. So again, there may be some overlap and some crossover between patients, and you need to be careful about these diagnoses. And then lastly, we wrote about patent extensions and the new biosimilars and what's going to happen there. The bottom line is that in the last 6 months, we have 3 drugs being approved by the Arthritis Advisory Panel, and one has actually been FDA approved, occurring 2 months after the panel recommendation. 2 were just reviewed last week and also recommended for approval. And while the approved drug Inflectra, the approved biosimilar Inflectra, is the new competitor to Remicade, and the makers of Inflectra, which is a division of Pfizer, suggest that they might have that drug up and running within a year. What's really going on is a lot of legal wrangling over the issues of patents, and that is likely to delay the appearance of biosimilars in the U.S. marketplace. So this is just starting now with Remicade and Inflectra. The 2 other new recommended biosimilars was one for etanercept, but we do know that Enbrel has a protected patent in the U.S. that could last up to 2029. On the other hand, the other recently recommended biosimilar, one made by Amgen, ABP 501, is a biosimilar to adalimumab, and there are multiple adalimumab biosimilars in development worldwide. And in the U.S., there's actually 4 manufacturers that would likely compete with Humira. That includes Amgen and Pfizer and Sandoz and Boehringer Ingelheim. And what's about to happen is an important legal battle, because their patent position expires presumably at the end of this year. However, Over the last decade or more, AbbVie, the maker of Humira, has acquired over 70 patents for the use of adalimumab, and they will try to exert those patents as being valid and in need of a patent extension to ward off the introduction of new adalimumab biosimilars. Again, this is going to be handled in the courts. There are two types of patents that will be looked at: formulation patents, how it's made, and then methods of treatment patents, which have to do with indications and dosings. And so it'll be interesting to see how new biosimilars can catch on in the United States and whether they'll be delayed by these patent issues. Time will tell. Tune into RheumNow. Go to the website if you want to see these citations and read up more on these reports. We'll see you next week with the Rheum Review. Good day.